Here in the Philippines, diabetes is a leading cause of illness which can result to death. People living with this condition don't often realize that they have it until they experience serious complications. But with early diagnosis and proper management, they can go on to live long and happy lives. On the program today, we'll talk more about diabetes, its symptoms, complications, prevention, and treatment. I'm Dr. Freddy Gomez and welcome to MedTalk Health Talk on CNN Philippines. Diabetes occurs when your body can't make enough insulin or can't use it effectively, causing an elevation in your blood sugar. Our guests are here today to tell us more about this condition. With us is Dr. Ralph Jason Lee, who is an endocrinologist from Manila Med and Providence Hospital. Also with us is Ms. Hazel Lat, who is a registered nutritionist, dietitian from DOST Food and Nutrition Research Institute. Diabetes, napaka-common ito sa ating mga Pilipino. A lot of people have heard of it. We're hoping that they will learn more about it from this episode because it is a common condition not just here in the Philippines but across the globe. Dr. Ralph, what exactly happens when someone has diabetes?
Diabetes is a chronic disease na nagkakaroon tayo ng mataas na blood sugar. There are several types of diabetes. The most common is type 2 diabetes. Ang nangyayari sa type 2 diabetes is meron tayong tinatawag na insulin resistance or hindi gumagana masyado yung insulin sa katawan. Insulin is important in lowering blood sugar. Another type of diabetes is type 1 diabetes. In this condition naman, nagkukulang sa insulin ang katawan natin. Most of the patients who have diabetes actually have no symptoms, lalo na if their blood sugar is not yet very high. That is why it is very important to screen patients with risk factors for diabetes. So if you have no risk factors naman, for Filipinos, we recommend screening starting at the age of 40. But if your blood sugar is very high already, you can have several symptoms. So one would be weight loss, or pwede nagkakaroon ng pagdalas yung pag-ihi, ihi ng ihi yung pasyente, or inom ng tubig, parang nauuhaw sila parati. Ito yung tinatawag rin na polydipsia.
Now, earlier we mentioned that the condition is a leading cause of illness as well as death here in the country. Dr. Ralph, what makes Filipinos prone to it? Please explain more.
There are several risk factors that predispose us to have diabetes. So if we have these risk factors, mas tataas yung chance natin na magkaroon ng diabetes in the future. So one risk factor is family history. So particularly if you have parents, siblings who have diabetes, there's also a greater chance that you will have diabetes in the future. Another would be being overweight or obese. So currently, mas dumadami yung mga overweight and obese na tao, especially during this pandemic. Okay, so that's another risk factor. If you have certain diseases like hypertension, problems, cholesterol, if you have a history of heart attack or stroke, these are also risk factors for diabetes. Another condition na nakikita sa babae is yung polycystic ovary syndrome. This is also a risk factor for developing diabetes.
High blood pressure is also another common condition among Filipinos, and it can be a byproduct of someone with diabetes. Ms. Hazel, pagdating sa mga Pilipino, ano ba yung mga karaniwang kinakain natin na prone tayo hindi lang sa high blood, pati na rin sa diabetes?
Sa mga Pilipino po kasi, as we can see their diet, madami tayong sausawan. Unang-una, ang hilig natin, magsisinigang ka, may patis. Titinola ka, may patis. Tapos, bukod pa dun yung mga pampaalat na nilalagay natin, asin. So, hindi naman siya masama, pero sobrang dami lang kasi minsan ng nakakain. Dahil nga daw nakakagana yung pagkain ng mga ganon. Lalo na pag nilagyan mo pa ng mga sausawan.
Is there a healthy way to eat a meal but still enjoy it?
So yung best diet talaga for people with diabetes po is yung healthy eating plan na mataas po sa nutrients and low in fat and calories. In short po, it is a well-balanced diet na kahit ng elementary days, itinuturo na sa atin sa science.
Ano yung mga values na kailangan malaman natin when it comes to what are the normal blood sugar levels and what test is best to get this?
The usual screening test that we use for diabetes is yung tinatawag na fasting blood sugar or FBS. Okay, so you usually fast for 8 to 10 hours before doing the test. And the normal level of fasting blood sugar is less than 100 milligrams per DL. Okay? If you have blood sugar of 100 to 125, you are already considered as having pre-diabetes. And if your blood sugar level is 126 milligrams per DL or more, you can be considered as having diabetes.
Pagdating sa pag-test natin, Dr. Ralph, you mentioned about pre-diabetes. Anong ibig sabihin ng pre-diabetic?
Pre-diabetes is parang a precursor for diabetes. Okay? So if you have pre-diabetes, actually you will have a higher chance of developing diabetes in the future. That is why it is important, if you know that you have pre-diabetes, to start on diet and exercise para ma-prevent na magkaroon ka ng diabetes in the future.
Now, diabetes is commonly found in adults, but we've seen an increasing number of children living with this condition around the world. More on this when we return. You're watching MedTalk Health Talk, your partner in healthcare. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk, where caring is our calling. Diabetes is a growing problem here in the Philippines, with 1 in 14 Filipinos living with it today. But awareness and better management of the disease can prevent complications and improve overall health. Anong nangyayari sa isang tao kapag ang blood sugar nila remains constantly high for a long period of time na hindi nakokontrol?
There are several things that can happen if that is the case. That is why it is very important that the patients with diabetes will lower or control their blood sugar. So several organs can be affected. One would be the blood vessels or yung ugat sa mata natin pwede maapektuhan. Ito ang tinatawag na retinopathy. Pag nagkaroon tayo nito, yung mga una natin nararamdaman is panlalabo ng paningin, and this can eventually lead to blindness. Another organ that can be affected with a chronically high blood sugar would be the kidney. So we can have chronic kidney disease. And if masira totally yung kidney, we have what is known as end-stage kidney disease. In this case, patients will need dialysis or kidney transplant. Another organ that can be affected is yung nerves or ugat sa paa. This is what you call as neuropathy. So ang mga nararamdaman ng pasyente is namamanhid yung paa, there is pain in the legs, or eventually pwede rin nagkakaroon ng mga non-healing wound. Other complications related to diabetes would be heart attack, stroke, and pwede rin in males, erectile dysfunction.
Now let's talk about heart disease and diabetes. Dr. Ralph, ano ang connection ng heart disease tsaka sa diabetes para maganda na ma-prevent natin ito?
We have what is known as yung tinatawag na insulin resistance. Okay? So, ang nangyayari dito is hindi masyado nga gumagana yung insulin ng katawan. And insulin resistance is associated with several diseases. One is type 2 diabetes, another is hypertension, and another is yung problem sa cholesterol or yung tinatawag na dyslipidemia. And then yung mga overweight or obese na tao, usually pwede silang magkaroon ng ganitong insulin resistance syndrome. So if you have this condition, especially if you do not control your weight, and if you do not control if you have diabetes and hypertension, eventually you might develop problems related to the heart. So mas tumataas yung chance na we have heart attack, stroke, if we do not control yung mga problems na nakikita natin in these patients.
Now, when it comes to children, we see an increasing trend of type 2 diabetes, and they're becoming younger and younger. And one of these reasons is yung diet nila. So, Miss Hazel, pag-usapan natin ang pagkain sa mga bata. What can parents do nowadays to change this trend? Pwede bang kumain ng healthy ang isang bata habang maaga pa?
Yes naman po, kasi yung carbohydrate intake, kasi nga the parents tend to feed their children ng madami. So yung carbohydrate intake dapat i-regulate natin. Yung carbohydrates such as rice, bread, potatoes, pastas should be regulated para hindi tumataas yung blood sugar. As much as yung kung gaano kadami yung kakainin, it depends on different factors po kasi, such as yung age, height, gender, and yung activity level.
Dr. Ralph, pagdating sa diabetes at mga bata, type 1 diabetes normally seen in children, but can you explain why the type 2 diabetics are normally seen in the younger population nowadays?
So, na-mention rin kanina about diet. So, our diet nowadays, more on the fast food, mga sugary food and drink. So, mas tumataas yung incidence or prevalence ng obesity in children. That is why mas tumataas na rin yung percentages of patients who have diabetes earlier on in life.
Kapag bata, kahit anong pwedeng kainin. They are, kumbaga, protected against any illness. Pwede silang kumain ng kahit ano. What is the risk with this kind of line of thinking?
That is not necessarily true na kahit ano pwede mong ipakain. We should have a balanced diet, increase the fiber, may mga vegetables, and as much as possible, of course, avoid rin natin yung mga sugary or sweet drinks.
Now, Miss Hazel, pagdating sa diet, importante ang diet, alam natin yun. Pero sa mga bata, gaano kaya importante din ang exercise or paggalaw? Siyempre, sa panahon ngayon, pakonte ng pakonte ang mga batang naglalaro or with any physical activity, mostly naka-glue sila sa mga gadgets nila. What is your advice when it comes to physical activity paired with good nutrition?
Before starting any exercise regimen, kailangan magkipag-usap muna sa doctors nila kasi para ma-establish yung target ng glucose. Kasi baka mamaya mag-exercise tapos bababa or sobrang tataas pala yung blood sugar, which in this case is very dangerous. So any exercise plan that is safe for you is kailangan i-consult muna natin kay doc.
Maybe increasing their physical activity, taking a walk with them, playing with them can already be helpful for them. So just increasing the physical activity and not really a exercise regimen plan may be good as a start. Okay, since we're on the topic of children with diabetes, let's talk about type 1 diabetes with Dr. Ralph. Dr. Ralph, if a parent discovers that their child has type 1 diabetes, what should their mindset be? How can this be managed effectively?
This is an autoimmune disease, meaning there is a problem in the immune system of the patient who has this disease. So ang nangyayari, inaatake ng sariling immune system yung part ng pancreas na gumagawa ng insulin. Kaya, for patients with type 1 diabetes, nagkukulang sila sa insulin. That is why the only treatment for type 1 diabetes is insulin medication. So this is very hard, particularly if you have a kid with diabetes, kasi you will have to give them constant injection with insulin. Okay, so usually aside from managing their diabetes, we advise parents na it might be better for them to have their kid consult also a child psychologist or psychiatrist kasi this is really hard for kids. It's also very hard to advise kids on how to do the proper diet. So that is one thing that can also be addressed.
Now, controlling blood sugar is especially vital because diabetes can damage important organs like the heart as well as the kidneys. When we return, we'll talk about tried and tested ways to manage diabetes effectively. Your health is our mission here on MedTalk Health Talk. We'll be right back. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, your partner in healthcare. Dr. Ralph, let's talk about the ways to manage diabetes and what is usually recommended for those who are diagnosed with diabetes. Let's start first with type 2.
For type 2 diabetes, there are 3 important points in managing these patients. The first would be diet. So we advise these patients to avoid food that can increase their sugar, particularly sugary food, high-calorie food. Okay? And then the number 2 would be exercise. Okay, so regular exercises, we generally recommend aerobic or cardio exercises such as jogging, swimming, biking, all those types of exercises. Mm-hmm. And this should be done regularly. Okay? The recommendation is to have at least 150 minutes of exercise per week. So both of this, the diet and exercise, can help in making them lose weight. Okay? And that is very important because when you lose weight, your blood sugar also improves usually. Okay. The third point is the start of medications. So type 2 diabetes is generally a lifelong disease. So they will need a medication, either oral medication or an injectable such as insulin.
Ano marirecommend nyo na amount of exercise para sa isang pre-diabetic or those living na diagnosed with diabetes na?
The goal is to get at least 150 minutes per week of moderate intensity physical activity. So one way to do this is to try to fit in 20 to 25 minutes of activity every day. So examples of this moderate intensity physical activities is yung brisk walking, yung doing household work. Kasi hindi naman kailangan mag-enroll sa gym.
Now, Dr. Ralph, for someone who is diagnosed with type 2 diabetes on oral medications, is it possible for them to go to a state where they are no longer diagnosed as a diabetic?
In cases na we have diabetic patients, particularly if their diabetes is not of long duration, and particularly if they lose a lot of weight, you can have what is known as remission. So meaning, if you are in remission, you will not need any medication. But that's rare. Most of the patients with diabetes will really need a lifetime maintenance medication.
Okay. Now, Dr. Ralph, pagdating sa treatment of diabetes, is it best na gamot agad, even in the pre-diabetic stage, gamot agad ang ibigay para ma-control ang diabetes para hindi na ito lumala?
For pre-diabetes, there are several options. You can try diet and exercise only. But in some cases, we might want to give them medication like metformin already, even at this stage.
Any tips, Ms. Hazel, pagdating sa diabetes, sa tamang pagkain, tamang pag-manage nito?
The best diet for people with diabetes is based on a healthy eating plan that's naturally rich in nutrients and low in fat and calories. So in short, a well-balanced diet. So yung carbohydrate intake should be regulated to avoid yung peaks in blood sugar, as much as depending sa individual caloric requirement ng isang tao. It depends kasi sa age mo, height, gender, and activity level. Also, choose complex carbohydrates such as fruits, vegetables, whole grains, kasi they contain good sources of fiber. So, limit or avoid natin yung foods na may added sugars like yung cakes, pastries, yung mga sweetened biscuits. Kasi ito yung makakapagpataas ng blood sugar.
Dr. Ralph, do you have any message for our viewers with regards to diabetes?
It is very important, particularly if you have the risk factors that I mentioned, being overweight or obese, or if you have those diseases that I mentioned, that you consult a doctor for possible screening. Okay? And for those who have no diabetes or kahit yung mga walang symptoms, it's still important to have healthy diet and exercise because this is one of the ways that we can prevent the eventual development of this disease.
Diabetes is a challenging condition to have, but it is manageable. It requires a commitment to a healthy lifestyle and careful control of blood sugar levels. But remember, when managed well, you can go on to live a full and healthy life. Thank you, endocrinologist Dr. Ralph Jason Lee and nutritionist Ms. Hazel Lat for being with us and sharing your insights. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk. We'll see you again next time.